Today I am going to discuss on how to use salts by the kidney disease patients, whether it is a chronic kidney disease or protein leakage or acute renal failure. Biggest challenge is intake of salts. These salts basically retains water in the body. That too, particularly when the chronic kidney patients, if they consume normally, they have to go for dialysis. And now I will give you some tips how to use the salts. Firstly, food has to be prepared normally in the house, not separately for the kidney patients. Only after boiling, the water released from the food should be taken out. In vegetables, pulses and leafy vegetables, whatever it is so. That can be used for whatever the purpose that family members, whether it is for soup or whether it is used for sambar, whatever it is so. And for these solids, they have to give tempering. That's what we call tadaka or vaggarane in Kannada, without giving salt. After tempering, because tempering is very important so that it will give good aroma, that food, otherwise patients cannot eat. And that required quantity has to be taken out, and 1 gram salt pocket has to be, keep it with them, and in 1 gram, whatever the quantity which is required, they have to use for the whole one meal. If it is a breakfast, for both sambar and other things, similarly for the lunch, for vegetables and other items, 1 gram is a very big quantity. Then they will see the resultant effects. Here, many confusions are there. Whether shall I eat potato, whether shall I eat tomato, whether shall I eat leafy vegetables, whether shall I eat, this fish and all. Anything they can eat, except what the things which I have advocated in what not to eat for the kidney patients, particularly pork, beef, meat, skinned chicken and all should not be eaten. Fish, it's a very good for the kidney patients, that too baked one with the defined herbs. And secondly, mushrooms for vegetarians with the defined herbs. Then one should follow these things in vegetables and leafy vegetables. So thereby they can control the salt, and also they can control the cereals, that is the rice and roti and bread, etc. Because when you do not give tasty these items to the patients, then they eat more rice and wheat and something else, then automatically it's having a 14% indigestible protein. That is the end product of the creatinine. So that's why one should follow these principles. So one should always think that in the food, everything it is there. Both the medicine, if you take like a medicine, otherwise it will be like a poison. Thank you.